Essentially, this is sort of the anti-PBM. You talk about remove the middleman, healthcare disruptor, things like that.
Fortune magazine actually did an article on the industry and stated that in the first time in the history of America, we'd actually dipped below the 20,000 independent level. And the number one reason was the profit margin. So back when I first started in the industry, the profit margin for dispensing medication was fair. It was about 36% profit margin, something that the pharmacies could live on. Today, you have any idea what that profit margin might be?
I'm going to have an unfair advantage if I can remember what you told me, 4 or 5%.
Yeah, three to 5% today, which quite often doesn't even cover the acquisition cost of the drug. Not to mention, you still have your overhead of a pharmacy,
Sure.
of the
So,
employees.
yeah, so simply filling more prescriptions isn't going to help you either. You're
No,
still at a negative margin at that point.
yeah.
Yeah,
Then
yeah.
on top of that, there's this crazy thing called a direct indirect remuneration. It's a clawback that the PBM can claw back payments that they've already made. So they're already not paying you enough to cover the medication cost. And then whenever they feel like it, they just go claw back payments. And so pharmacies are just saying, throwing their hands up and saying, okay, we're just going to close our doors, or they sell their files to the big chain, and big chains, and one of those big chains is also owns one of the PBMs who's helping them go out of business so they can buy their files. Something wrong with that,
Yeah,
right?
I was going to say snake eating its tail in a not so nice way.